coming in a bit later. Hopefully, a few more people will pop in during the session as we move on. Hopefully you're in the right place as well. So this is, just if you're in any doubt, this is the social prescribing of community urban food growing, transforming citizen health, neighbourhoods and futures. My name is Mike Hardman. I'm one of the co-chairs of this session. I just want to give a very brief introduction as to what we want to do in this session, the flow of this session, and just to remind everyone of some of the etiquette as well as we go through the session. Obviously, doing this via Zoom, so we want to have some discussion, but we want to make sure that it's not too chaotic as well. So hopefully you are in the right place. You know, you're here to hear a little bit about social prescribing and urban food. The reason we put this session together is that we've, and many of you as well would have seen, there's been a huge rise in urban food growing spaces, adopting social prescribing, pursuing this concept, sometimes at quite a radical scale as well. We're starting to see many community gardens and urban farms and other urban productive spaces looking to explore social prescribing, to connect with communities in different ways, to offer new income streams as well. Research has shown that quite a few, particularly of smaller spaces, often reliant on grants funding, and this could offer another opportunity space to bring in much needed revenue at times. There's also quite a lot of policy tools and mechanisms around this as well, as many of you will be aware of. In fact, many of you have probably been there and wrote a lot of these documents at both a national, regional, local level. Things like the DEFRA 25-year environment plan that pushes quite radical concepts such as care farming, talking about upscaling that, and social farms and gardens are doing some really wonderful work around creating more spaces for that concept in the UK, all the way through to school gardening and beyond. Things like the green recovery, so the more kind of post-COVID rhetoric that we're finding now, green recovery and pushing this as well. We're aware of funding from central government around this, and again, a big focus around what we're speaking about in this session today. As many of you are aware, because you are practitioners, you're pioneers in this space, there's a huge amount of evidence base to show the health impact, the health and well-being impact of these spaces. I will put in the chat box in a minute, unless my colleague Michelle can, a paper that we had recently in the British Medical Journal that kind of summarised this, led by Michelle, looked at a lot of the evidence base there and pulled it together. And there's a lot out there as well to show the really fantastic work that's being done by a lot of these small and larger scale urban food growing sites. We are aware that there are a lot of challenges with regards to social prescription as well. And what we want to do in this session is to reflect on the realities, to look at the nitty gritty, to look at people who are doing this on the ground and reflect on those barriers, but also the opportunities with this practice going forward too. So that's kind of my meta overview of what we want to do today. Just before I introduce our wonderful speakers today, I just want to go over some house rules if possible. I know some of you would have heard these before in the other sessions, just the usual etiquette for these kind of Zoom calls. So just out of courtesy, if possible, please, can you just make sure you're muted during the session, just for our speakers as they're going through the various different presentations. What we're aiming to do in this session is to have some structured presentations at first. We'll take a couple of questions between the presentations, and then we'll have a general discussion at the end, which myself and my colleague Elizabeth, who's on this call, who you'll hear from shortly, will administer. So we'll pick out some questions. We'll invite you to turn on your audio if you're willing to do so. Don't be worried if you don't want to. We're not going to force you to speak to everybody. You can write it instead, and we're more than happy to read it out for you. And then we'll put it towards the presenters from there as well. So there will be that discussion towards the end. In fact, the vast majority of the session is on that discussion, because we realize you as participants, you've got a lot to add to this session as well. It isn't just the speakers who are, kind of leading this, should we say. This is being recorded. So if you don't want to be recorded, please switch off your video. So this session is being recorded for the conference as a whole. So make sure that you switch that off if you're not willing for your face to appear on the recording. And I think that's pretty much it for most of the house rules. I'm looking through my list of things. Becky will flag, I'm sure, if I've missed anything off. No, I'm good. I'm great. Fantastic. So we'll move on to the interesting part, which are some of the faces you've probably seen on the screen. And I think this is what really makes this session unique and exciting, is just the variety of people we've got speaking in this, and obviously yourselves as an audience as well who all participate. We've got academics, we've got practitioners, we've got evaluators, we've got nurses in here as well. So you're going to hear from so many different lenses, so many different perspectives on this, and some really exciting projects from community farms and growing hubs, all the way through to the Royal Horticultural Society, which is a much larger organisation pioneering some really fascinating work here in the heart of Salford. So I'm just going to give a quick introduction to some of our speakers. I'm sure they will say a little bit more about themselves in a minute. First up in a minute, when I pass over to my colleague Michelle, we've got Dr. Michelle Howarth, who is a national lead for social prescribing and also leads the social prescribing hub at the University of Salford. She's done a lot of work in Greater Manchester and more widely across the UK on this concept, working on leading the evaluation team on the RHS project that she'll speak about today, but also publishing widely on this idea as well. The BMJ paper, but also papers in many nursing journals and health journals as well. So we're very lucky to have Michelle on today. We've also got Elizabeth Westaway, who is an international public health and nutrition specialist. She's worked as a practitioner and researcher and a consultant in academia, NGOs, and with the UN on health, nutrition, food security, and agricultural projects in all sorts of places across Africa and Asia as well. She has a PhD in international development from the University of East Anglia, and she was formerly on the steering group of the People, Food Power and Nottingham Good Food Partnership as well. So I think Elizabeth will bring a lot to this discussion, both from an academic perspective, but also from a practitioner perspective as well, which should be fascinating. We have some really wonderful other practitioners in this room today. So we've got Charlie Gray, who will speak towards the end of the kind of presentations. So Charlie is a director, and she's also a community trainer at the Horticulture Community Farm. It's a land permaculture centre for food growing and community resilience in Bradford city centre, so not too far away from where we are in Manchester. She's worked there for over 10 years. She's developed their programs. She works across the 5 strands at the farm, so education, wildlife, therapy, volunteering and food growing. She's been a pioneer in terms of fundraising, designing and delivering lots of pilot projects around cooperative working with partner organisations. She's worked in the community quite a lot in Bradford as well. Some really interesting projects that I think we'll hear about today in her presentation, looking at forest schools, outdoor education, horticultural therapy, and more recent, the mindfulness garden in the project as well. She's been working quite recently with commissioners, GPs, and social prescribers as well. And so we'll bring another perspective to this session. And last but not least, we've got Tim. Tim, fantastic here to have him today. He's got a lot of experience, over 25 years experience in the voluntary sector. Since 2011, he's been the manager for the Woodland Community Development Trust, which is based in Glasgow, so up in Scotland. He's overseen a lot of really interesting projects and highly successful work, including a community garden and community cafe, the creation of a Woodland Workspace, new community buildings and event spaces as well. I think what's really interesting, and I know a lot of participants as well will kind of link with this, is that during COVID, they've really stepped up, and Tim's been heavily involved in the pandemic response at the site as well. So they've expanded their frontline services. They've had an increased focus on mental health and well-being, and really tried to help the community through this difficult time as much as possible. Again, something we've seen across the sector, and it'd be really interesting to hear Tim's perspective as well on how they've been responding during this crisis. Tim has a law degree and a master's in welfare law, so very interdisciplinary background, which is really exciting to hear, and has come up to this area. And later this year, he's got a self-published novel called The Banquet of the Beasts, which sounds much better than any of my books. It sounds really fascinating to him. You'll have to send a link in the chat a bit later if you can. I apologise, I've waffled on for far too long now. I'm going to pass over to my wonderful colleague Michelle to take us for our first presentation today, which is all about the Royal Horticultural Society, their social prescribing scheme, and some of the evaluation that the university's been doing. So I'll mute and disappear for a bit.
Thanks, Mike. So I'm just going to share my screen just to Okay, so can everybody see the slides? Are those clear, Elizabeth and Mike? Yeah. Okay, still clear? Brilliant, thank you, thank you. Okay, so thanks, Mike. That was it's really interesting that there are so many people from varied backgrounds in the room. I actually recognise a few people's faces, which is lovely. Anyway, I shall continue without further ado. So my name is Michelle Howarth, and I'm a senior lecturer in nursing at the University of Salford. In the School of Health and Society. We're one of the biggest providers of health and social care education in the UK. So as you can imagine, recently we've been pretty busy getting our nurses and everybody prepared and integrated within the global pandemic and the subsequent results of that. But I've always been interested in person-centred care, and in particular how social prescribing can help improve well-being. And I've got a particular passion for how nature-based interventions can promote well-being. So I'm really here to set the scene about what social prescribing is, and also give you a couple of examples that we've been working with, evaluating over the past couple of years. So I shall first of all give you an overview. So social prescribing is one of those funny things that seems to have a lot of definitions. So the Social Prescribing Network in 2018 provided a definition there and talk about social prescribing being a process of enabling frontline staff to refer individuals to a link worker, provide them with a face-to-face wellbeing conversation during which that individual understands the possibilities that person, involves them in decision making and enables them to design their own personalised care. And that's great. NAS, which is the newly launched National Academy for Social Prescribing, says it's about supporting people via social prescribing link workers to make community connectors and discover new opportunities, building on individual strengths and preferences to improve health and well-being. There's a common pattern here. Essentially, my own take on this is that it's a non-medical process. It uses assets, and it uses assets like nature-based interventions to support people, and in particular what matters to that person rather than what's the matter with them. In medicine and in nursing and in healthcare, we have tended to focus on fixing people. We've tended to focus on what's wrong with people rather than what matters with them. So social prescribing is a way in which you can look at an asset-based approach to personalised care. And the key to that is the link worker, which we won't go into much detail about today. There's a lot of different models and pathways. So Richard Kimberley's work in 2014 has highlighted some significant different models. There's this most basic one, which is signposting, and that, to my mind, isn't the truest sense of social prescribing in the fact that it doesn't offer a personalised approach, because it's a very basic referral. It often means pointing somebody, signposting someone to a knit and natter group or a stitch and bitch group or a yoga session without really having a conversation. There's no follow-up to say, did that work for you? And that signposting can happen quite frequently. People can just walk into interventions and social prescriptions, areas that provide asset-based approaches without a social prescription. So I'm very mindful that one of the organisations I worked with a number of years ago, most of their referrals, people had come to them through word of mouth and just turned up on the doorstep. And there are risks to that, obviously. Then there's the social prescribing medium, where there is some kind of health facilitation in place, and there's that good relationship with that individual. But that might not necessarily be about a person-centred approach. So the common one you might have come across is prescribing Weight Watchers for someone who might be overweight, or prescribing a trainer for someone who might need to get more physically able and fit. There's no real follow-up as such. It's a, there we go, you've got a particular challenge, this is a solution. The holistic approach, which is what most social prescribing models offer, is that where the link worker has that meaningful conversation with an individual, they try and understand what matters to that person and then refers them to an asset within the community. So if that's a nature-based asset, if that system works, it means that that referral and the people that come along to that nature-based asset are actually the right people. So what you don't want, which is risky, is people turning up with really acute problems to a local allotment group, and actually that local allotment group hasn't got the skills and capacity to support that individual. So when a social prescription works properly, it should be the holistic approach so that there is that conversation with the wellbeing conversation with the link worker or the community connector. So across the UK, the government's invested a heck of a lot of money to make sure that every primary care network has a link worker or community connector. There are other roles that are emerging as well. And essentially that referral, whilst it comes from a healthcare professional at the moment, could actually be broadened out. So those referral routes might well change and develop as time goes on. But ultimately, there needs to be a process to make sure that that individual, when they arrive at the doorstep of the social prescribing offer, and whether that be a gardening offer, whether that be therapeutic horticulture, whether that be a care farm, are actually the right person, and they've been sent there because they've had a conversation with somebody. So that, I hope, gives you a bit of an oversight into social prescribing and the processes. What I wanted to do is provide a couple of examples of the work we've been doing, certainly within Greater Manchester. And the first example is when we worked with the RHS, so they've obviously set up their 5th garden, Bridgewater in Salford. They have developed a wellbeing programme, so and that was developed about a year or so ago. It was a 12-week programme. Therapeutic horticulturalist was trained, and that individual is still there. And they received referrals from the enhanced care team, GPs, and later community connectors referred in as well. Now, they did a range of different activities while they were there. And if you read the BMJ paper that we posted on the chat room, you'll see that understanding and actually evaluating nature-based interventions is really problematic, because there's no real sort of one description of gardening, for example. There's no one description of therapeutic horticulture. So it's seasonal. They might do different things. They might do anything from sowing seeds, as you guys all know, sowing seeds right the way through to developing raised beds, helping design gardens. But the idea is that it's a structured programme of activity, and that's what these people had when they were referred. We evaluated this using SWEMWES, so that's the Warwick and Edinburgh wellbeing scores. We actually tried to capture heart rate variability as well, particularly to look at people with chronic long-term conditions. We also used the International Physical Activity Questionnaire to see if their scores had improved. And we also captured qualitative data through focus groups with people who participated as well. The reason why you need to capture so much data is because that triangulated vision helps you give a real good picture of the impact of that particular service. And collectively, that data highlighted that what was going on was really good. The feedback from the participants was really positive. I'll give you examples at the end. And that the quantitative data was also illustrating to us that actually this is a really positive thing. People are getting benefits from this. And what we did notice from this is you can't just rely on a lot of the push behind social prescribing is to see, does it reduce GP attendance? But actually, if you look at the types of people that access social prescribing programs, they often have long-term comorbid conditions. So it's not like these people are going to stop their hospital appointments. It's not like these people are going to stop their regular GP visits, because they need to do that to enable them to continue with the review of their condition and their development. But what they hope it does is it stops inappropriate GP visits and inappropriate hospital admissions as well. Another programme that we evaluated, which was just down the road from Salford, which was earlier on, which is Garden Needs, that used a very similar approach, mental health recovery programme using therapeutic horticulture. The referral route was the same, and in that example we used recovery star data, and again that was measuring mental well-being in particular on sort of a Likert scale along 10 sort of areas. We also did qualitative interviews, and we also captured the exit interviews as well. So collectively, those different types of data provided a really rich picture of the impact of those particular interventions. So challenges to all of this, and this is replicated in the literature as well, and our current evaluations of a social prescribing programme in Salford has already highlighted that actually raising awareness and getting referrals in the first instance can take some time. And often, you know, GPs, health professionals, those people that are referring in aren't aware. Link workers sometimes are, because often the link workers come from the community in which they're employed. So they know the assets in the community, they've asset mapped it already. Certainly the ones in Salford are born and raised in Salford, they know what's out there. And then there's the belief in, so once you've raised awareness, it's how do you get people to believe in this as an effective outcome? So how do we tell people, yeah, therapeutic horticulture is brilliant, care farming is brilliant, and that's often reliant upon the evidence base. A lot of the organisations are reliant upon the evidence base to capture funding. So Garden Needs was one example where we did a small scale evaluation, which enabled them to apply for further funding, which then enabled us to go in and do a larger scale evaluation. There's the capacity. A lot of the people who go to these programmes and have a social prescription in place have real complex needs. They're the sorts of people that don't quite meet the acute care sector. And by that I mean they're not quite poorly enough to be taken over by the acute care sector. So some of those needs are quite complex, and that's about then understanding the training support for people who provide a nature-based intervention, and making sure that that social prescribing referral process works properly, so that you don't get someone turning up at your door who actually has a lot of problems that you don't have the capacity to deal with. And then the evaluation, no one tool fits all. The which tool for well-being, evaluating well-being for green interventions was produced a number of years ago. I'll put the link up. And that gives you a really nice idea about the different tools you can use to capture. But I would strongly recommend that you use a range of tools, because there's a range of different outcomes from each service and every offer is quite different. And finally, the successes. I wanted to leave you with these quotes, because what people are doing out there, what you guys are doing, and the sorts of nature-based interventions that are provided offer a real lifeline to individuals. You know, we've had conversations where people have said, I had a rope around my neck. That was it. I was gonna do myself in. And they found themselves somehow in this gardening group or going through a therapeutic horticulture programme, being given skills to carry on and do something else, to do something different, connecting with other people, connecting with the environment, just listening to the birds, being outdoors, having a view. We don't necessarily need to do anything physical, but it makes them feel human again. And ultimately, from my perspective and from theirs, particularly those people with mental health problems or those problems that have a real stigma attached to them, they can go into a nature-based social prescribing offer and know that they're going to be treated as a person rather than a condition. So I will shut up at that point, because I've no idea how long that took, and hand over for any questions.
Thank you very much, Michelle. That's really interesting. We've got time for a very, very quick question. Iris, do you mind coming onto the microphone and asking your question, or do you want me to ask it for you? I'm happy either way.
Yeah, I'll just say it as I wrote it. Hi, Michelle. Thank you for that. And my question was, I'm just going to quote it: is there a risk that, as what's happened with the arts and arts funding structures, which I'm very familiar with, that's my background, that social prescribing may mean that charities and other community organisations end up having to cater for, or being expected to cater for, people's essential needs, which aren't being met by the healthcare and welfare systems?
I think there is a risk, and I think that's probably been experienced in some examples in some areas. I think that if the social prescribing referral process works correctly, then the link worker or community connectors should be actually identifying those people that are inappropriate. And what shouldn't be happening is people shouldn't be coming to you or your organisation who actually have a very clear clinical need as opposed to social need. So, for example, the work that we're doing with the Wellbeing Matters programme at Salford CBS, there's 5 community connectors. They have a very robust wellbeing conversation with individuals, and they can pick up from those who, you know, sometimes people are inappropriately referred to them and they go, hang on a minute, this person's got a lot of complex needs, there are a lot of clinical needs there, they actually need X, Y, and Z. If that process works properly, then the people providing at the other end shouldn't be receiving, you know, people that they haven't got the capacity to support. So it's a really good question, and yes, there is a risk there, but if that prescribing referral process works properly, that risk is mitigated. And then at the other end, I guess people that, you know, if you do have people that are just walking off the street, there's then the obligation of the organisation to think about their capacity and ask those questions. Can we really manage this individual? Do they need to go back to their GP? So it's making sure there's that feedback loop. So some of the social prescribing quality assurance standards that were brought out a couple of years ago talks about risk for the person, risk for the referrer, and risk for the organisation that receives the referral. And it's like this triple lock thing where you've got to make sure that each of those areas of risk are mitigated. So.
Thank you, Michelle, and thank you very much for that question as well. We're going to move on. Unfortunately, it is me speaking next, but I'm going to keep it shorter. Thanks for Michelle for giving that context, for setting, you know, I think it's really important to have that definition to understand from the outset what we're talking about here. Hopefully you can see my screen. This is taking a slightly different track, and my talk here is only about 6 or 7 minutes to highlight some innovative practice that's happening in Manchester, or sorry, in Oldham, sorry, Greater Manchester, in Oldham, not too far away. Some of you might be interested in here, and this radical intervention as well. Some of you might have heard about this before. It's been in the news a fair bit, but I just want to reflect on what's happening in Oldham and this really interesting project called Northern Roots that we've been working on since about 2017 from the university. The gist of it is it's about upscaling urban farming, but also having social prescription at the heart of it. So care farming in the heart of Oldham, effectively, a multifunctional space that has an eco park using the landscape for walking, for mountain biking, but really the productive side of it is at the heart of this project. I'm just speaking on behalf of the project. Anna De Silva, who some of you might realise used to be the head of the RHS Bridgewater, is now the head of Northern Roots and has been doing some fantastic work there since she took up the post in the end of 2018. Prior to that, a team headed up by Jackie, who worked for Oldham Council since retired, led the development of this space. Effectively, it's a large 160 acre bit of land, which is right next to the heart of Oldham, but it's unused. And it has been unused for a long time due to a lot of it being an old tip site. So the quality of the soil further away from the bit towards the town centre isn't that great. It's not fantastic for building housing or anything, so it's always just been left in a space that nothing really much has been done with. In 2017, we started to do some work with the community to find out exactly what they would want on that space. What do they want to see happen on that space? And it was quite surprising to see so many of them talking about urban farming and this idea of they've seen the farms in Wythenshawe. There's some really wonderful examples in Rochdale as well. And that was one of the key things that came from that, was about creating something that was multifunctional for the community, but something that could help them reconnect with their food system in a way. So a really pioneering project that's come a long way since 2017. They've had a bit of grant funding. They've had some funding from the council, and they've currently got funding with the Towns Fund to really kickstart the next phase of the project. A lot of the work at the minute has been on kind of tackling a lot of the inaccessible spaces in terms of the modelling for the care farm as well, and linking with other projects around the region. So I just want to really share with you some of the interesting elements of this site. I do apologise, I think that picture's come up a bit fuzzy on my slide. It's an older picture of what this could look like, and work has already started on the community garden, which is at the top of the site. So that's another site that was has been operating for many years and has now been changed over to this site to give them a bit more space to operate. But in terms of this scheme, when it's fully operational, The plan is that it could create over 100 jobs and volunteering positions. That's already happening with some of the bee hive schemes they've got going on the site already. So they've already got volunteers on the space. There's environmental benefits to this space as well in terms of increasing the biodiversity in Oldham itself, in terms of generating green energy, in terms of carbon storage, and much more on top of that in terms of enabling this local food system, acting as a hub model for the many different growing sites that already operate within the Oldham region. And I think particularly for this session today, probably the highlight here is the social prescribing angle and you know, where they want to go with this idea of, based on similar models, they want to pursue this idea of up to 300 social prescriptions a year at its height, not in its early stages, as something that they want to explore later on down the line. And the team have got expertise in this. They were behind some of the RHS work that Michelle was alluding to, where they've had several a year already, and smaller projects across the region as well. So it's a really fascinating project. It's using leftover space that otherwise would just lie there. It's got a lot of antisocial behavior around there. There's a lot of misuse of the space at the moment as well. Not a lot of people use it apart from walking their dogs. Work has already started. It isn't just some sort of artist impression or utopian master plan. And they've already appointed to roles. This has been going for a few years now. You'll see quite a lot about it in the press as well if you have a Google about it. And it kind of fits with this rhetoric, as I was saying at the beginning, of this green recovery, green jobs that the government are invested in quite a lot. A lot of people within Oldham, a lot of people don't visit Oldham. A lot of the current sites are used mainly by residents. And this is also an opportunity to bring in tourism to the space, as well as thinking outside the box with regard to social prescription. Oldham, if you look at the stats, there's many out there, have above average levels of people being admitted to hospital for mental health issues. There are some pioneering work going on around social prescribing, but it's on a relatively small scale. And this is all about bringing it to that next level. Some of the work we've done is shown that you know, the model that they're going to be using here is one that doesn't rely on grant funding as much. It works with the local town centre and some of the other projects a bit more to generate funding. We've done quite a lot of work behind the background at the university across not just the UK, but around the world, looking at exemplar practice and influencing the modelling for Northern Roots to allow them to implement a model in terms of the produce they're going to grow all the way through to the workshops that they run, to allow them to start small and then build up from there as well. And as I said before, the big hurdle here is the Towns Fund that they hear back about from in October that will provide something like £27 million, not just for Northern Roots, but for the regeneration of Oldham as well going forward. There's work already going on. As I said, this isn't a utopian vision. They're already doing a lot of work on the ground. They're already engaging communities. And it's one of those projects I think it would be worth having a look at for those of you in the room who are interested in this at scale as well. They're working with projects, they're not stepping on projects' toes, and they're a wonderful project team who are very creative, but have got that expertise as well. So I just wanted to highlight quickly a little bit about that project. It's worth having a Google of. I'm going to be quiet there because I want to pass over to my colleagues who are going to come in and speak about their projects as well. But if there are any questions, put them in the chat box. Otherwise, we can have a little bit of a discussion at the end as well. Okay, fantastic. Oh, sorry, I've just undone my screen. All my tabs have disappeared. Okay, so given the time, we'll move on then if there's, oh, sorry, is that a question? I can't remember. Katie, was that a question for myself or was that for Michelle? Sorry. Oh, don't worry if you can't present. Oh, for Michelle, that's fine. We'll come back to that in the discussion then. I'm going to swiftly move on if that's okay and pass over to my colleague Tim, who I believe is the next speaker. And I'll let him share his screen and tell us about his wonderful projects and the work he's been doing as well.
Okay, one sec. Can everybody see that? Yeah, brilliant. Okay, thanks, Mike. My name's Tim. I'm the manager for Woodlands Community Development Trust in Glasgow, and I've worked there since 2011. On the screen, you'll see pictures of our initial project, which was Woodlands Community Garden, which this year is celebrating its 10-year anniversary. So this was a derelict gap site We are pretty much based in central Glasgow, a stone's throw from the M8, in a highly residential area. It's about a third of the population are students, about a third of the population are from a black and minority ethnic background. And there was a derelict gap site, which 10 years ago we turned into a community garden. And I'm going to talk to you a little bit about our projects, some of the challenges, some of the health gains which we've had. And we've actually had virtually no contact or involvement with NHS or social prescription. So it's coming from a different perspective about how we are having these massive impacts and doing things very quickly on the ground, but aren't formally linked into the NHS, and some of the opportunities perhaps from the other way round about how the NHS can also learn from what's happening on the ground. So we have a community garden, we have 50 raised bedders, but the garden was designed as a social space as much as a growing space. So I often describe it as an outdoor community centre. So we have schools and other community groups using the space for outdoor education and activities. And it's been running for 10 years. We also have, for the last 6 or 7 years, a community cafe. This grew out of cookery classes, which we did over the winter months in Glasgow, where people might not want to be outdoors quite so much. And we teamed up initially with a night shelter for destitute asylum seekers and took food around there. And that grew into a weekly community meal and other community food work. So on the left, you've got a picture of Graham, who's one of our volunteers who has learning disabilities. And pre-COVID, we were serving 70 or 80 meals a week every night on a Monday night, entirely vegetarian or vegan food. And we'd had 2 staff and about 12 or 15 volunteers. And on the picture on the right was a visit we had a year or 2 ago from Nicola Sturgeon for one of our Christmas cafes, where the community food work had been highlighted as an example of best practice for inclusion and some of the health benefits of people. And in Scotland, we've been working closely with an organisation, Nourish Scotland, around dignity in food provision, and our community food work, which grew out the garden, was very much seen as an alternative to a food bank and offering something which was more empowering and healthier. Our third main project is Woodland Workspace. This was a site which had been a derelict building and had lain empty for about 25 years. And after a rather tortuous process, we took a lease off the council and raised capital fundings to have a community building, which you can see on the right-hand side at the top, which is a prefabricated building, which in normal times we hire out for all sorts of community activities, starting from £6 an hour. So a very affordable and actually quite a small community space, which supplemented our community garden. It's literally 2 doors down from the community garden. And also at the lower level of that picture, there's an outdoor events terrace, which we built over the winter last year, not knowing how much that was going to be needed come COVID. And I'll talk a little bit more about our COVID responses. So there are 3 main projects. Normally we have 6 or 7 staff. Actually, over the last 6 months of COVID, we've actually expanded our staff team and taken on 3 new staff as a result of sort of emergency ScotGov funding. And we've also had to reinvent the way that our work is done. So our community garden has stayed open throughout the whole pandemic, and I think has reinforced to me even more the health benefits of outdoor space in a very residential area. We're in a very highly tenement, everyone has tenement or flats. Very few people have green spaces of their own, and any empty spaces are pretty much being built into student accommodation and private housing. So there's a shortage of accessible green space. We've reinvented our community meal, community cafe as a neighbourhood food service. So we're working with a local mental health charity, a local housing association, and another big community hall. And between us, the 4 organisations are doing a twice weekly meal delivery service. And at last count, it was around about 9,000 meals delivered during the pandemic. And we've also established what we're calling our Nature Recovery Project, which was a direct response to COVID. And this came out of a Zoom meeting we did with our raised bedders as we call them, the people who have a growing space at the garden. And a lot of them were talking about how coming to the garden was helping them cope with the stress of the pandemic. So we've done various responses through that nature recovery project, including using the arts, using creative writing, using meditation. But we've also developed an outdoor counselling service. One of our longest standing volunteers, Judy, is a mental health professional by background, and we've just employed her directly as a freelance mental health professional, initially as a 6-week pilot, but now funded to the end of the financial year, meeting people one-to-one, no formality to the referral process, a quick assessment on the phone, and then one of the most positive feedbacks about that is that people are getting an appointment the same week they're phoning up. So there's no waiting list for a referral for counselling. And then we're able to signpost, or Judy's able to introduce them to our other support work, whether that is the meal service, whether it's the arts workshops, or whether or not it's just hanging around in the garden. So we're getting people who we wouldn't normally get through our doors who are coming in through that. I'm actually going to do these slides the other way around. So in terms of response to the COVID pandemic, in the 6 months, this is until the end of September, we delivered over 8,000 meals. And we've also held over 220 hours of workshops to reduce isolation, a mixture of both online and in person. So I think in some ways, the pandemic has made us really focus down much more. We were doing a little bit of this, but it's made us think, what do people need, and how can we best support the local community? And Judy, through word of mouth and our own marketing, which has been pretty much our own Facebook and mailing list, had on her books 22 people who she's been seeing through outdoor counselling. Again, there's no time limit on how often people are seeing. It might be one-off, it might be 4 weeks, it might be 6 weeks. And we've done over 1,800 hours of gardening support with our gardening staff. And normally we do a lot of group work, but that has been reduced to sort of one-to-one and front garden makeovers. So we've had a lot of impact. And a strong ethos through ourselves is, again, the environmental messages around climate change. So we have a climate action project, and that is involving cycling and food and waste. And I'll just say it's kind of not totally relevant. Again, a lot of what is frustrating me is a lot of the COVID response. I've seen the Scottish Government have been really great at putting funding into frontline support and emergency support, but there isn't a huge linkage between that support and the climate crisis and the climate emergency. There isn't that holistic thinking between connecting those up. We're a charity, we're a local charity, we're not a city-wide service. We currently have 11 staff, if you include the cleaner, and the cleaner is pretty central to what we're doing now with COVID as well. But in terms of challenges, short-term funding and grant funding was mentioned in a couple of other talks. A big chunk of what I do is fundraising. We've had 72 different funding sources over 10 years. And that's for a staff team averaging probably about a full-time equivalent of 5. And that's actually how we've managed to keep going, is by having multiple funders. A lot of the funding is project funding rather than core services. And the community garden, as the longest established project, is actually the hardest to fundraise for, because it's not seen as new, it's not seen as sexy, it's seen as well established. If I wanted to build a new garden site, I could probably get grant funding more readily for that. A point about the social prescription and maybe the risks to the voluntary sector, I think, is around full cost recovery. So it's not just about the cost of the staff who are actually out in the garden, but it's about the back end stuff, about the finance and about the admin. We don't really have any referral mechanisms. It is word of mouth and it is drop in. For garden volunteers with additional support needs, then we might do an initial assessment, simply because we would normally have 2 garden staff and there's a different difficulties of how many people they can work with at any one time. But I think our success has been built on the openness and the speed of which people can actually access the support. Having said that, all our staff are used to being on short-term contract after short-term contract. So Vicky, our garden development worker, has been with us 9 years, but I don't think she's ever had a contract longer than 12 months during that period. Our links with health services are very ad hoc and informal. We've got a GP who comes to the garden to volunteer, to de-stress, I think, from the life as a GP. We've had visits occasionally from student nurses, but it tends to be very much linked into a person or a linkage. And again, within our staff team, because we have the people coming through our doors with the health issues and we're seeing the health gains, we're not necessarily got that incentive to go out to the health service and ask for more. And we've had 2 small grants from the health service in the 10 years, both of which were less than £3,000, and they were for cookery activity and came with a wee bit of monitoring as well. Challenges: we would like to expand our services. We've got a closed waiting list for raised bed, which is kind of quadrupled since COVID. So we've actually closed the waiting list for raised beds, but accessing land is difficult in a city centre. It took us 4 years to negotiate the lease with the council on a derelict gap site, which had been laying empty for 30 years. So access to land is a key. And we're constantly adapting our service to COVID. So I think we're very proud of how we've reacted in reducing socialisation, having a strong focus on stress, but it does have an additional workload. It has an additional cost in terms of cleaning, in terms of just planning, and the constant speed at which guidance is changing is quite exhausting. We did pull off an event for our 10-year garden anniversary 2 weeks ago, which we're really proud of. And we had 200 people at an outdoor event over a weekend, but that took 10 staff for an event which would normally have 3 or 4. So the costs of actually running these services and doing group work are increasing. I'm going to finish with 2 quotes about some of the health impacts which we've seen from our service. The first with a garden volunteer, Colin, who has autism, learning and speech difficulties. And this is a quote which his brother gave us. Prior to coming to the garden, he'd never really engaged in conversation. He only answered questions in 1 or 2 words. And since his time at the garden, this has radically changed. He always returns excited with a full story to tell. And he's been staggered by this change in Colin. The support and respect of the workers had had a huge impact from him. His self-confidence and self-esteem has grown hugely as a result, and attending the garden has been transformative. Again, this was a referral which came in not through NHS, but through word of mouth and local residents, and one of Colin's carer lived around the corner from the community garden and had approached us, and this whole health gain was actually brought about with no contact with the health services in any way. So I think there is a gap there also from the other way around, from what can the health service learn from the front line. A more recent quote, which was from Catherine, one of our staff, who emailed me about the impact. She's been running an outdoor art workshop in the garden, and we've been finding creative ways in which we can still do things and maintain social distancing. And this was a quote where 2 of Judy's listening service, the counselling service, had attended to the arts workshop, and they're also going to go along to a breathing workshop the following Wednesday. And it was really nice to hear the 2 of them striking up a bit of a friendship. One of them was telling me her story. She nearly died from COVID in April. She's got chronic fatigue, can literally only walk around the garden once, then she's in the bed. And she's so grateful for Judy and the Woodlands. Judy was one of our longest standing volunteers. And one of the things she said, which is she's really pleased about how the service is operating, is not just that there isn't a waiting list, but that she can directly link people in. So she can say to somebody who she's met for counselling, and there's an arts workshop coming on Wednesday, do you want me to take you along with it? And they'll meet them. And that is easier for somebody than saying, here's a phone number, or here's a support number. And that whole process is taking maybe a week or 10 days from referral. And that is doing with little or no involvement with the health service. So I think there is huge opportunities within social prescribing, but I see it opportunities for the health service, not just necessarily opportunities for the voluntary sector or community sector. But what I would like to see is that there's full cost recovery brought into that, so that actually some of the behind the scenes costs, whether it is with marketing or admin or and how us as a charity can keep that going. We generate about 15% of our income through non-grants. Most of that was through our income through our rental building, which is closed from COVID. So again, I think there's real opportunities, and we've had very little contact from any of the local NHS despite all these health gains. And I'll finish there.
Thanks, Tim. You're a star. Thank you very much. That is mind-boggling, some of the stats you put up on there, and clearly you've done a heck of a lot of work with your team as well. I think Becky summed it up by saying it's very inspiring to see that with your site. If I may, I'm just going to move on to Charlie briefly, because I think some of the things that you brought up we can bring into the discussion, because there's some bigger funding issues and some of the debates there, just to fit in Charlie's talk, and then we'll go on to the discussion to make room for that, if that's okay. If we could just move on to Charlie, please, if possible, just to show your presentation, and then we'll come back and revisit some of what Tim was talking about, which I think is really important for the wider sector as well. Thank you, Tim.
Yes, thank you. Oops, I'll go back. First page. Yes, I will hide this because I think otherwise you get a grey blob on the screen. Thank you. It's been really fascinating because, well, I think unless you're up and running with, I don't know, 10 years funding ahead, then this sector generally feels quite insecure. So I can relate a lot to what Tim has been saying, and interestingly, I think we probably find ourselves in the middle somewhat, in that we've actually worked very closely with some mental health professionals, some occupational therapists mainly, who have brought individuals to our site to be part of our horticultural therapy programs. But we also have done a lot of our own, mostly what we've done is gone and got our own funding and tried different projects. So I'm going to talk about a sort of cross-section of the different things we've done. So yeah, I think you'll find that we fall somewhere in between sort of doing it our own way with our own funding, and we have actually now got some commissioned, a commissioned service, but it's still kind of short term. So I'm Charlie, I'm from Horton Community Farm. I'm a director of the project. I've been with the project since the beginning as a volunteer. We all came out of Transition Bradford. Tim referred to, climate change and environmental concerns. We were very much, we were all permaculturists. I think most of us had met on permaculture courses. And so we were really concerned with environmental impacts of our current ways of living, as well as the social side of it. So permaculture does have 3 ethics of earth care, people care, and fair shares or future care. So my title is Community and Training Coordinator, but funnily enough, like Tim, I may well have applied to about that number of grants in the last 10 years. The project has been running, we started as volunteers in about 2008, but we've been constituted as a company limited by guarantee since 2011, and we got some sort of medium-large funding from making local food work from the lottery fund in 2012, and that's when we were able to employ 5 part-time employees, and I've been part of the organisation ever since as a member of staff, and we all put in extra voluntary hours as well, so it's a part-time role for me, and they've always been part-time roles for other people. We work as a cooperative. We have that written into our mem and arts. We don't actually have a cooperative legal structure, but we're currently looking at that at the moment, whether we become a charitable benefit society, and that way we could offer shares in what we're doing, or potentially set up a charitable arm because we do offer the therapeutic side of it and also educational work. So I'll say a little bit more about the project, and then I'll talk about the different groups that we've worked with over many years, and hopefully this slide will become a bit clearer. We have the strapline: we are a land permaculture centre for food growing and community resilience. So we all started by being passionate about our food system and what we could do to make a difference, the 5 of us that started the project. And so food has always been at the heart of what we do, growing, cooking and eating, serving food to other people, educating around the food system, but also this idea of community resilience, and how we could work with people locally, see what they wanted, and try to offer those things as services. So we work with 5 strands of kind of work areas, if you like. They are education, wildlife, so we do make sure everything we do is as wildlife friendly as can be. We increase habitat for wildlife. We work with therapy, so social and therapeutic horticulture, which is the main part of the presentation. Volunteering, we have very long-standing volunteer projects, sessions, and the project really is volunteer and community led. And the last one is the food growing. I'm very grateful to Elizabeth for inviting me to speak today. I wouldn't say we are necessarily yet a model of how to do it, but like Tim, I can talk about lots of the experience we've had of getting out there, finding our own funding, and more recently we have been commissioned to run a programme just for 2 years. That's the largest funding we've had for any of our therapeutic offerings, and we've actually been given another year by the council, which is brilliant. So hopefully you can see in the hexagons there are smaller hexagons which link the photograph to the description. Elizabeth made a suggestion about the 3 sort of topics that I should talk about, and I think they were good topics, so I've taken those up. So the first one was how we are a very multicultural project, and because we are functioning in the city centre in Bradford, so like Tim, we're in a very urban area, it's very built up. And so we do work with people from many different communities. I believe I did a back of the envelope count, and I'd met people from over 100 countries. So I haven't needed to travel the world. I've met people here in Bradford. We are in a typical post-industrial northern city that is struggling with health inequalities, a lot of deprivation, already before the pandemic, and we are in an area with high BAME populations. In fact, the ward that we work in, so this is the hyperlocal link, with a picture of some women, some Asian women eating in a local community centre. So these women are mostly of Pakistani and a few Indian and a few Bangladeshi women as well. So a lot of the people we work with are in communities where people migrated post-World War to help rebuild the city and to run the mills, and also people of Caribbean origin came to run the transport systems. So actually where we work, it is 90% Pakistani British in our ward, and that is quite surprising to a lot of people, but you know, it's a very residential area right in the city centre. So we do, you know, obviously we work with people who are residents and who are active in the local community. So this was a community centre that was built post riots, because Bradford had some serious riots. So they were there to help with community cohesion, and really to offer services, you know, that were very tailored to local communities. So we've done, this was a winter warmth health grant we had, where we went and we cooked vegetarian food, and then we did seed sowing with the community, and we've worked on numerous projects. The second one is we do offer things district-wide, so people do come from all over Bradford as well, depending on their interest, or in this case, this is a picture of a Sikh group offering seva. So it's their part of their religious commitments is to offer voluntary work to the community. So we've had many groups coming and helping out from all over the city. Like I said, we're volunteer led. So we built the whole site, which was 2 acres of near derelict allotments. So similar to Tim's situation, the allotments hadn't been properly looked after for 30 years. And it's quite unusual because we do currently now have a waiting list as well, but the waiting list typically has moved very quickly. People have come and gone because of the state of the allotment, and it really it wasn't being managed properly, and just got very overgrown. So we've actually got a farm tenancy agreement on the nearly 2 acre area of the site that we have, but we're actually in the process of trying to go for an asset transfer on the whole site, which is a 5 acre site, which has a dry stone wall on one side in a residential street, and is also on one of the main streets in Bradford, which has a lot of curry houses and takeaways, and is also a residential area. So it's a very busy, very built up area, and we're lucky to have this 5 acre urban oasis. So number 3 is university. So it's also very multicultural because the university has a lot of international students, and the students really were our biggest source of volunteer labour in the early days of the project. And we have continued to have volunteers from the university throughout the project. We actually started our first volunteer sessions on a Wednesday afternoon to fit with the time when students were free. And we now offer internships to students at the university in the summer. So there is a programme called the Summer Experience. And it's funded. It's a funded placement. We often joke that they used to get paid more than we do. I think we get paid about the same now as workers. Yeah, so this has been running for, I think we've just finished our 8th year of internships. So students get to support the rest of the programme. Obviously we've had, there's been migration in the last 20 to 30 years, and this is largely around, you know, war, conflict, human rights issues and politics. So there's a picture of a lovely man there who, an asylum seeker who unfortunately was and I think probably still is stuck in the asylum system after I think 18 years, simply due to politics because of where he's from, I think. So our social and therapeutic horticulture programme actually focused on asylum seekers and refugees, and typically funding for working with these groups can be quite challenging to find. But the reason we focused on this group in particular, I'll talk a bit more in my 3rd slide, but is because of our network. So we're very well connected to City of Sanctuary networks. Bradford has a very active DIY community, voluntary sector, and in particular has very good infrastructure in terms of voluntary sector for asylum seekers and refugees. I guess it's just grown out of need. So in the last 10 to 20 years, number 5, we've mostly had migration from the extended European Union areas. So there are large population from lots of countries in Eastern Europe, but in particular in the area we're in, the hyperlocal area, is actually people of Slovakian and sometimes Roma origin. So we've deliberately recruited interns. So you can see a picture there of Alex and Amina, who were interns that could speak languages that would be relevant to local populations. So that's something we've been really mindful of in the last a few years. We've done a lot of door knocking to try to reach neighbours and residents. And number 6, the last one, is the fact that we are in a very diverse city, and also the fact that our food comes from indigenous and traditional cultures, and we really need to celebrate the current mix of our food system. You know, we really wouldn't have without the practices, the seeds and the food from elsewhere. So because we're a permaculture land centre, we haven't had many, but we have offered permaculture courses and tried to educate more broadly around the food system. So that's quite a broad introduction to where we are and how we work, and the fact that we're very multicultural. And this slide really is to just show the range of people that we've worked with in general, but also asylum seekers and refugees. So we have found we've worked with men. Very often we get referrals for individuals via a large range of City of Sanctuary partners. We have had referrals from GPs, and we have started working more closely with particular organisations. You'll hear about that more on the 3rd slide. But what we found is very often men are living, you know, they arrive on their own quite often and then live in a house with lots of other men, but don't know each other, maybe don't have other languages in common. And so the men that have come to our social and therapeutic horticulture sessions have found that doing the manual work, having activities, but also space. We're quite a large site. I think, yeah, a lot of the feedback is that they're just really grateful to be out of the house, to have something to do. And we give volunteers take home food, and sometimes we'll share suggestions of how to cook. And we also serve soup at lunchtime, so the volunteer sessions run over lunch. I'm just going to keep an eye on time. Sorry, I'll try and get the chat. So we have had women come to the site as well, and we have found that we've recently, in our last programme that we've been offering, the Mindfulness Garden, we have offered women's sessions as well. Sorry, I'm just checking the chat because I can't tell if I'm going over time. You might just need to tell me.
A tiny bit, but one more minute maybe, if that's okay.
1 minute. Really okay, so anyway, the point is most of our referrals were through City of Sanctuary, but we found they all had the same GP service. So that got us thinking. So we tried to work with the social prescriber from a very specialist GP who offers services to, it's actually a social enterprise. I think it's may have a charitable status as well, but they work with people who are homeless or precariously housed, including asylum seekers and refugees. So a lot of the referrals came from them. And my last slide was really just to show the more of the horticultural therapy side of it, but my slide seems to be stuck. So maybe I should just leave it there. Oh, it's stuck. Oh, there it is. I'll just put it. Oh. Yeah, oh, there it is. Yeah, so basically, very, very quickly, because I think it might be useful for some people, we actually had somebody, a member of our staff team, we funded them to go and study a diploma in social and therapeutic horticulture. So the first picture, which says garden, is actually the design that she came up with on her course. She got a distinction. So we built that garden, and it also had a program attached to it. So a year-long program for working with people with mental health difficulties. And we decided, like I said, to work with asylum seekers and refugees. We worked with a variety of organisations as partners. We've worked with housing associations. We worked with the homeless new arrivals team. That is actually a picture of one of them in the referrals. photograph with the lovely man Abdul, who was with us for a number of years but has moved to Sheffield. And we have had commissions for specific pieces of work, shorter projects, and we currently now have council commissioning from the health and wellbeing team, and this is for our mindfulness garden. So we've managed to now get our 3rd year of funding for that, but we are still finding it is challenging to have the match of people who want the service, people who can fund it, and people who can refer to us. So we're currently taking advice and guidance from commissioners and other organisations. I'll leave it there, sorry.
Thank you, Charlie. No, this is the trouble. I'm used to sharing academic ones, and academics tend to, but what I love is that, we needed to give more time for particularly yourself and Tim, because it's, this is actually happening on the ground. This is where the impact is, and this is where the lessons can be learned a lot as well. So, I think that's a really fascinating overview, and both projects are doing so much on the ground, well above and beyond, as you said. The amount of volunteering hours on top is astronomical. And we have got a bit of time for discussion now. And what I want to do is start with kind of a theme from Katie that brings together Tim's and Charlie's projects a bit more, and kind of is aimed at yourselves. Katie, I don't know if you can turn on your microphone if possible, please, because it'd be really good to have you join in and ask those questions to the project. You've got a couple of really good questions in there. Thank you, Katie. I'll hand over to you.
That's all right. Thank you. And thanks to everyone for the presentations. They've been totally inspiring. What I wanted to ask really was how many of the problems that are faced by your communities are fundamentally about poverty, and related to that, things like food insecurity, and what we can do to raise the profile of those issues. And kind of related to that is, I attended the session on Farm Start the other day, is how many of the people in your communities go on to be trained and educated in horticulture or agriculture, sort of that potential to lift people out of poverty by giving them a profession. I know that things like Organic Lee get funding for higher education and then put people through City and Guilds courses, and the Kindling Trust in Manchester is doing something similar with Farm Start. So they're kind of related issues, I think, that kind of poverty, raising people out. How do we address that? So,
thank you, Katie.
Complicated question.
No, it's fantastic. I'll invite the presenters, if you want to use your emojis, if you want to pop in, but I'm going to ask Tim maybe just give Charlie a slight breather if you want to respond to any of those questions.
On the poverty, it's certainly a strong aspect. I think when we started our community cafe, we thought that would be the main focus, but I think social isolation is just as big as poverty. People, from what we're seeing locally, we have a relationship with our local Citizens Advice Bureau. So normally when our community meal is running, we have advice services there with them. And we've also inputted to Scottish Government policy forums around food insecurity, and we do a lot of work with Nourish Scotland around dignity in food and their campaigns about right to food. So we do have that aspect certainly around tackling policy. I can actually come from advice and rights background. In terms of horticulture, I think we've got a staff team of 11, and I would say probably 7 or 8 of them started as volunteers. So we may not be having employment elsewhere, but a lot of our staff started as volunteer, and our cleaner started through a supported employment placement with a mental health charity. And certainly I know some of our garden volunteers have gone on to work in horticulture or conservation. We don't have as much links as we would perhaps like with farm and agriculture being a city centre, but we have got a climate action project. So I know one of my colleagues has been talking to an open farm network about having food supplies directly from local farmers. So I think there's still that gap between city centre and farm just because of our location. But there are also maybe not that many careers in horticulture and gardening within a city context. They tend to be in the voluntary sector. We actually pay above industry average, and I think one of our successes is that our pay scales are higher than what most of the charities pay, and I think that's how we've been able to retain good staff as well.
Thank you, Tim. That's really interesting. And just to reflect on Charlie, I don't know if you've got anything to add to any of those two questions from your perspective as well. Sorry, I've caught you with it. There we go.
Yeah. I don't want to talk too long, but yeah, I guess training and qualifications you mentioned, that yeah, they're definitely key. I mean, volunteering is also useful because we always give references. I mean, that's something that's, you know, is useful to people. They might then go on to another volunteering opportunity or then get a role elsewhere. I mean, because we're managing a site and we actually ended up managing the 5-acre site, even though we're not officially in terms of keeping paths open and stuff like that. A lot of our, we do work on a shoestring, but a lot of what we do goes into kind of maintaining, keeping that running. We don't have any core funds, so it's quite hard for us. We're kind of at that in-between stage to get the next level of employment. But if we improve the infrastructure of the whole site, we have actually just applied for some green recovery funding. If we get it, then that will include jobs. And there was some ESF funding that we applied to for getting people into work. We weren't successful, but we'll try again. Yeah, so it's definitely part of what we aim to do, even if we're not doing it yet.
Fantastic. Thank you, Katie. Michelle, I don't know if you've got anything to add from the garden needs perspective, particularly with question 2. I know that was a really inspiring project in Salford that you worked with for several years. Apologies for putting you on the spot, but I don't know if there's any kind of reflections on that from what Katie said.
Yeah, no, I was just thinking actually, because when a number of years ago, when I first started getting interested in personalised care and how we promote that, I looked outward beyond the NHS to look at what was in the community and the assets. And I literally walked into garden needs. It was a shack, it was some gardens, and basically it just started off. And I said, as an academic, I'd be really keen to evaluate the impact of this. So we literally did a really small evaluation. We literally spoke to 5 or 6 people. I did it on a shoestring budget. It was me going in and going, tell me what's happened, blah, 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 blah. We created a small report from that. And I think because it was an external organisation going in, like a university, and providing that, even that minuscule evidence base as was then, they used that to then apply to, I think it was the Big Life Reaching Out Communities Fund, I can't remember what it was. And they got a substantial amount of money to develop their mental health recovery programme, which we went back and evaluated on a larger scale. So I think there's something then I learned then, it's about having that evidence base. But the catch is that not everyone's got even a couple of thousands to pay for evaluation. So I think there's something around, you know, we do need to demonstrate what's happening out there. Part of the reason that we did that paper for the BMJ was to highlight the impact of gardens and gardening on well-being. And because the evidence, you know, it is out there, and I challenge anyone to say that there is no evidence for therapeutic horticulture, for social and therapeutic horticulture, for care farming, etc. It is out there. It's just not in. It's just not used the methods that commissioners like randomised controlled trials and experiments, which are impossible to do because every intervention's different. Every outcome is fairly different as well. So I think there's work to be done around collaborating with commissioners, collaborating with people to say, look, there is an evidence base, it is strong, and working with people to try and get, well, you know, if you do want an evidence base for what it is you're doing, or working with different institutions to say, how do we do this? And I think for me, it's not always about buying in universities to do that for you. It's about building in evaluation methods that are well used, that you can use to support applications for more sustainable funding. It is a bit of a catch-22 though, and it's like, where do you start when you haven't got the evidence base? And clearly we have to start somewhere. Yeah, it's hooking into the champions, it's finding out what's available, and it's generating an evidence base that will convince people this works, and it works for the benefit of X, Y, and Z. So I think it's tricky, but I think it's really tricky.
Yeah, thank you. I think that's really helpful, and thank you to the others for contributing to that as well. And we've got some really other interesting questions as well. We've got Baker Monday, you asked, I don't know if you want to come on the microphone as well, and don't worry if you don't want to. I don't want to put you on the spot if you're there still on the list.
Yeah, I'm here.
Yeah. Fantastic. So you asked some questions a bit earlier on, and I know there's some chat about it. I don't know if you want to, it kind of links through to about existing spaces, was your question?
Yeah. So, I mean, I was interested in if there is a farm or a garden that is currently functioning, how much investment and work is required to transform that into a care setting, because I imagine there are implications for health and safety, for accessibility, for safeguarding. I mean, does this get monitored? There was a very useful contribution from Sarah Morrison that I haven't looked at, I think, which addresses some of those questions. But yeah, if there are any other responses to that, to sort of transforming an existing space that is already functioning as a conventional farm or growing setting into a care setting.
Thank you. That's a really important question. I have Charlie or Tim, if you would like to, I guess you've been there, done that, got the t-shirt in some respects. If you want to add anything from your own sites or from the wider projects you've worked with?
I maybe just a kind of COVID related observation. We actually had a staff meeting last week and we spent an hour and a half talking around mental health and well-being, and in terms of the challenges of now that we've kept the garden open but staff are largely working on their own or coming in at different times. There's less staff team and there are more people with sort of long-term mental health who have other forms of support are closed and are coming in and enjoying the garden as a space, but are putting additional strains on staff. So we've always been quite informal in our systems, and the PVG system in Scotland, Protecting Vulnerable Groups, is currently just been modified as well, so that normally we work with other people who have expertise in working with those vulnerable groups. But with COVID and with the changing working practice, it's much higher up our radar. But I think we kind of saw it as that we created the garden and then it became the therapeutic space. We didn't actually have to evolve the garden. The garden itself is a therapeutic space. We are reviewing it, how different areas of it can be made more accessible. So it's a constant learning process. So I don't think there's necessarily a separation. I think it's things evolve. But definitely at the moment we're finding that we're having to respond to an increased need around mental health during the pandemic, and part of that is due to the challenges of being open but not doing the group work, and our staff coming in, but a lot of the groups who we might work with to provide those support on operating. So again, I think it's to do with people's degree of risk, and I think we've been a little bit more creative than some organisations who have shut everything down. As a smaller organisation, it can be. I'm not sure if that answers the question. It's a constant evolving thing rather than you have to do it. But again, it depends on the type of clients you're working with. We're currently in meeting with a local asylum seeker night shelter. But again, they have their staff there who have those trains and those disclosures and the expertise, and then they're bringing us in as an extra support. So again, it's about the partnership working as much as it is about transforming a space.
I think also maybe there's a difference between urban contexts and rural contexts, because I'm familiar with farms in rural contexts, and I try to imagine these farms being able to accommodate therapeutic and care activities, and then I suddenly realized that there are a whole heap of accessibility issues and other health and safety issues that the healthcare system and industry is legally, statutory. They have obligations, statutory obligations, legal obligations when they refer patients, service users. They have to be settings that are safe. So it's just an interesting thing to think about. I think with urban settings, yeah, there's probably more, there's probably more institutions that can accommodate those issues. But in more rural areas, I think there are more significant challenges.
Thank you. I think that's really, sorry, Charlie, I'll let you feedback. I've got to sum up in a second, but I'll let you do a quick feedback to that, if that's okay.
Yes, if that's okay. It's just because we are currently working with our commissioners to look at what we would need to do to be on, their list of approved commissioners longer term, because they've just been changing their system. So I think even if the exact kind of details of how it might work in a rural versus an urban setting might be somewhat different, once people start to do it, and and they've got people who've gone through their quality assurance guidelines and got the risk assessments and all, which PPE they need or whatever it is, I think it will seem a bit less daunting, because I think it's just going through the details really. But the commissioners really, they're trying to have some standards, sort of quality assurance. At least here in Bradford, that's where we're at.
Thank you, Charlie. That's really helpful, and thank you for adding to that discussion as well. I do apologise. I'm going to have to cut things short here. We tried to embed discussion throughout as much as we could, and had kind of a mini one at the end, shall we say. I just want to it's really difficult to sum this up in 30 seconds. But I think what the projects have shown, that there's so much innovative practice out there with regards to social prescribing. It comes in different shapes and forms. We've heard about informal approaches compared to more formalized models as well, which is really eye-opening how some projects are doing it not off the grid, but in a different way than perhaps what Michelle was talking about at the beginning. And we've looked at the importance of these projects during COVID as well, and we already knew that, but I think really particularly Tim's slide, what showed those stats, was really eye-opening and showed that we need to support these sites, post-COVID. We need to have more funding opportunities, funding that takes care of, as Tim was talking about, the kind of the backside staff as well, that it isn't just paying for a new member of staff to come in, providing that kind of surface approach. I think that funding side of things really came through quite powerfully, particularly in the latter two talks as well. We looked at tools and the importance of collecting evidence. Michelle, fantastic there, looking at the importance of collecting evidence and showcasing some tools, not necessarily getting universities involved, but how you might be able to do that yourselves as well. And I think overall, it just showed you how much amazing stuff's going on out there, all the way from Scotland, all the way down to Manchester and beyond as well. This is really exciting to hear about the work that's going on. There's so much more stuff going on out there as well. The chat's captured so much of it. So thank you very much to everyone for adding to the chat all of those extra bits of useful resources. And thank you, Charlie, Tim, Michelle, Elizabeth, and Becky for your time in coordinating the session and giving up your valuable time today to share your expertise and knowledge as well. I'm going to hand over to Becky just for a quick finishing touch to this, just from the wider conferencing team. But thank you from myself as well. And some of our email addresses are in the chat box. I'll let Becky finish off, and hopefully I'll see some of you in the near future. Becky, over to you.
Thanks so much, Mike, and everyone. Yeah, just nothing really to add. Just lovely to have you all with us. And yeah, just as we said at the start of the session, so all of these sessions are being recorded, so you will be able to see like a copy on YouTube somewhere. The speakers' contact details went in the chat, so if you want to get in touch with the speakers privately, then please do that. And yeah, I'll be saving the chat as well. It won't go on YouTube or anything like that, but if there are, yeah, I'll make sure nothing gets lost, so you can ask me if there are things outstanding from the session. But yeah, thank you all so much, and yeah, it was lovely to see you.